Hi, you're listening to the Baby Manual podcast, the podcast that helps you feel confident as a new parent. I'm your host, a pediatrician and mom, and the author of the Baby Manual, Dr. Carole Keim. Hello, and welcome to this week's episode of the Baby Manual podcast. This is episode 8, Feeding Your Baby. We're going to talk about breastfeeding, formula feeding, pacifiers, nipple confusion, and some oral hygiene. The next few episodes, we're going to do a deep dive into certain topics that I get asked about a lot, and these are laid out just like in my book, The Baby Manual, which is on Amazon and Kindle. So this week we've got feeding. Next week is going to be things like peeing and pooping, gas and colic. Then we're going to go over skin stuff in June and sleep, and then illnesses, red flags, and vaccines. So get ready for some good deep dives here. To start off, how often to feed your baby. So newborns will eat 8 to 12 times per day, and they do need frequent feeds because their stomachs are so small. A baby's stomach when they're first born is about the size of a cherry, which is 5 to 10 mLs or 1 to 1.5 teaspoons. Babies, when they're first born, are just eating colostrum from mom, which is a super concentrated breast milk. Typically, their bellies are filled with amniotic fluid when they're first born, so they really don't need a lot of volume. They just need those concentrated nutrients from mom. And that's true for the first couple of days of life. On day 2, their stomach is about as big as a walnut, which is 20 to 30 mLs. By a week, it's the size of a golf ball, which is 45 to 60 mLs or 1.5 to 2 ounces. So they can drink a little bit more at a time by a week of age. And by 1 month of age, they're able to take up to 2.5 to 5 ounces, which is the size of a jumbo egg, or 80 to 150 mLs. A baby's stomach will stretch like a balloon, and so you can overfeed them. You can feed them more than their stomach size is intended to hold. But typically what happens is that their stomach stretches, and then when they go to digest, they reflux it up. And that's because they have a muscle. There's a muscle between the esophagus and the stomach called the lower esophageal sphincter. And that muscle is not fully developed until they're about 6 to 12 months of age. So for the first 6 to 12 months, it's normal for children to have a little bit of reflux. And when they overeat, sometimes that reflux will come up so much that they end up spitting up. So 8 to 12 feeds doesn't work out exactly to every 2 to 3 hours, unfortunately. And babies do tend to cluster feed, especially in the early morning hours. And that's because your prolactin level is going to be the highest between about 2 a.m. and 6 a.m., which of course is the least convenient time of day to be feeding a baby, right? But a lot of times babies will want to cluster feed, at least for the first 2 weeks of life during those wee morning hours. And that's because you're going to have the best milk production then, and they can sense that even formula-fed babies. So that usually goes away around 2 weeks of age. Around 2 weeks of age, they start to learn the night and day difference. And so they start to sleep a little more at night and a little less during the day. Now, for the first couple of months of life, if they're sleeping for more than 4 hours, you need to wake them up and you need to feed them. And that's because if they go too long without eating, they can end up skipping an entire feed. And over time, that can cause them not to gain enough weight and not have enough brain development. So it's really important to feed them at least once every 4 hours for at least the first month or 2 of life until your doctor says it's okay to let them go longer. Now, a newborn up to 2 weeks, they might eat more than 12 times in a 24-hour period, and that can be normal. By about 2 weeks to 2 months, they're typically eating closer to every 2 to 3 hours while awake, and then sometimes going 3 to 4 hours at night. By 2 to 6 months of age, you can usually let them go a little more than 4 hours between feeds at night, but you do need to make sure it's okay with your doctor and make sure they're gaining enough weight. So what to feed babies? Of course, we talk about breast milk a lot being really good for your babies. They can have breast milk or formula only for the first 4 to 6 months of age. And in other countries, I know they say only for the first 6 months of age, nothing but breast milk or formula. And that's because breast milk and formula have all of the protein, fat, carbohydrate, and water, also vitamins and minerals that they're going to need. And around 4 to 6 months, you can start to introduce solid foods. And we're going to come back to this in a little bit. So benefits of breastfeeding, we do recommend in the US exclusive breastfeeding for the first 6 months, and then breastfeeding plus food and water until 1 year of age or later. And it's okay to breastfeed as long as you want. You don't have to stop at a year of age. You can keep going for years if you'd like to. It's totally healthy and safe for children. You can and should eat a wide variety of foods while you're breastfeeding. In fact, you shouldn't be cutting anything out unless your doctor tells you to specifically. It's better for babies to get introduced to a whole bunch of different types of food proteins because they'll be less likely to develop allergies later in life. So cutting out foods while you're breastfeeding can actually predispose your baby to be more likely to get allergies later in life. So definitely eat a big variety of foods as long as you're not allergic to them. Also, the whole time you're breastfeeding, you should be taking a prenatal vitamin. And that's going to contain iron and folic acid. Be careful with some of the gummy prenatal vitamins. They don't have iron in them. So just double check that it's got iron and folic acid. And that's to replenish your stores as a mom so that you don't get too depleted in nutrients. Also, omega-3 fatty acids, at least 200 to 300 milligrams per day. That can help with the brain fog that comes along with being a new mommy. Also, calcium, 1,000 milligrams per day to replenish your stores as you're breastfeeding. Also, you should be taking vitamin D. Now, the recommendation currently is for everyone of all ages to take 400 units of vitamin D per day. Now, if you're a breastfeeding mom and you wanted to get enough vitamin D into your breast milk that you don't have to supplement your baby, you have to take 6,400 units per day. So that's an extra 6,000 units per day. And as far as we know, it is safe to do that. We don't have any cases that I know of hypervitaminosis D or having excess vitamin D. And it does seem to be safe to do that while you are breastfeeding and can also decrease your risk of postpartum depression. So taking that excess vitamin D, 6,400 units per day, is enough to give your baby 400 units in the breast milk per day. Now, you can also supplement baby with vitamin D, and that's perfectly okay to do too. Did you know it's actually okay to drink alcohol while you're breastfeeding? And that's because of the first pass metabolism of the alcohol being absorbed through the stomach and passing through the liver. So if you think about, imagine an 8-ounce drink of 10% alcohol, that would become a 0.04% blood alcohol content, which is going to be the same as your breast milk concentration. Now, when your baby's on the inside of you, when you're pregnant, your blood alcohol content is the same as baby's blood alcohol content because alcohol diffuses across the placenta. But when a baby is drinking breast milk that has 0.04% of alcohol in it, so that's 250 times less concentrated than what you drank, that means that their blood alcohol content is 0.0001%, which is undetectable by most labs. And it's actually less blood alcohol content than they would get after having a glass of orange juice or eating an overripe strawberry. So it is perfectly safe for you to be drinking alcohol while you're breastfeeding, as long as you are safe to hold your baby and take care of them. So if you are so drunk that you are at risk of stumbling into a wall while holding your baby or dropping them, or falling asleep while breastfeeding them, these are all real dangers. So you do need to make sure that you're safe. But if you're safe enough to hold your baby after drinking, then you are safe enough to feed your baby. You do not have to pump and dump. In fact, pumping and dumping does not make it go away any quicker. It's still going to leave your body at the same rate. And if you want to have the very least amount of alcohol in your breast milk, then you should take a drink while you're breastfeeding or immediately afterwards, because then 2 to 3 hours later, when baby's breastfeeding again, your blood alcohol content will have gone down. So each time a baby eats, they are placing an order for your next feed. So for the first 3 to 5 days when you're producing that colostrum, it's important to keep baby on the breast for a good 15 to 20 minutes. And that's just to stimulate your milk production, to make it come in. Once your milk is in, then you can kind of watch baby's cues. And the first sign that a baby is hungry is that they're awake, that their eyes are open and they're looking around. And then the next sign is that they're opening their mouth and rooting and reaching with their mouth and their face. And then a late sign is that they're crying. And a lot of times if you wait until they're crying to feed them, they're going to get really frustrated and it can be harder to get them to latch on. And that's true for breast or bottle. So when baby is first awake, when you first have your newborn, you want to be feeding them. And then you can start to watch their cues to see when they seem hungry as they get a little bit older. And then when baby's done, typically they'll do some kind of light sucking, just sort of not real nutritive sucking, but just light sucking. And at that point, it's okay to give them a pacifier. And it is safe to do that even from birth, to give them that pacifier to see if it satisfies them. If you don't do that, they will probably just keep sucking on your breast and you can get pretty sore pretty quickly when that happens. So I do recommend using pacifiers at the beginning. They also decrease the risk of sudden infant death syndrome, or SIDS. And I don't actually believe in nipple confusion, and we'll talk about that a little bit more in a little bit. All right, so more benefits of breastfeeding. There is an emotional benefit to mom. It does release oxytocin, which is a bonding hormone, and it also releases endorphins, which are natural painkillers and things that just make you feel good. It has health benefits. There are decreased risk of postpartum bleeding. You might feel some cramping when you're first breastfeeding, especially, and that is normal. That's the oxytocin causing your uterus to contract and shrink back to its pre-pregnancy size to decrease that postpartum bleeding. There's also a decreased risk of breast cancer and ovarian cancer in women who breastfeed, a decreased risk of rheumatoid arthritis, a decreased risk of postpartum depression, and they say it burns an extra 500 calories per day. So in some women, this helps them to lose their baby fat a little bit quicker. But also keep in mind that it makes you really hungry and, of course, really thirsty. So some women will actually gain weight while they're breastfeeding because they're eating so many extra calories. With baby benefits, there's a decreased risk of obesity long-term in babies who are breastfed and a decreased risk of type 2 diabetes as adults. Also, less chance of getting any kind of infection, including respiratory infections and GI infections like vomiting and diarrhea. That's because you're passing antibodies through your breast milk to your baby. And antibodies are things that fight off infections. So one really cool thing is that as you kiss your baby, you pick up the germs that are on their skin. And then as the mom, you produce those antibodies to whatever germs are in the environment. And you're giving them exactly the immunity that they need to fight off whatever is around them. So I just think that's super cool. I sometimes joke that you should just lick your baby to try to get all the germs. You don't actually have to do that, but give them lots of kisses. Another baby benefit is that there's a decreased risk of SIDS or sudden infant death syndrome in babies who are breastfed, and they're less likely to have allergies and autoimmune diseases as adults. There's a couple extra benefits that nobody really talks about that I do like to talk about. Breastfed poop is water soluble, so it rinses right out of stuff super easily. So if you're doing cloth diapering or a diaper-free method, it's way easier to clean breastfed baby poop than formula poop. And it doesn't smell bad like formula poop does. I mean, they'd still get gas, and yeah, it still is poop, but it kind of smells like cottage cheese and not really like poop. Also, it's always available. It's always on hand. You don't have to carry anything extra with you. And one really cool thing is that the composition changes as your baby grows up. So as they get older and their needs change, your breast milk will change to accommodate that. Also, it's free, and formula is really expensive and not always readily available. So it's very nice to be able to breastfeed. Now, it is tricky to learn how to breastfeed. And I've heard it described as the hardest natural thing that you'll ever do. And I believe that. It can take babies up to 2 weeks to fully get the hang of it. Sometimes you think they're doing fine for a couple of feeds, and then it's like they forgot how to breastfeed. And that is normal for the first 2 weeks. So just keep at it. And I recommend trying for a good solid 2 weeks before deciding whether or not breastfeeding is for you. It can actually also be painful for those first 2 weeks, but then that gets better. So the best advice I got was to aggressively moisturize my nipples. Every time that baby eats, you should be putting on nipple cream afterwards. And it's kind of like chapstick for your lips. Your nipple skin is about the same as your lip skin. And if you've ever had chapped lips, it just kind of burns and they can crack and it can get really painful. There's also a little bit of pain when baby first latches on. So that is normal for the first 2 weeks. They said it's normal to have even toe curling pain for up to 10 seconds when they first latch on, but then it should get better. Now, if it doesn't get better, you should speak to your doctor about it or speak to a lactation consultant because there might be a reason for that. Some babies have tongue ties, and that can make breastfeeding difficult. And with the latest recommendations by the Academy of Pediatrics, they say only to repair class 4 tongue ties. So that's when their tongue cannot stick out past their lips or when it makes a W shape when they're crying. So if you see that when you're a baby, talk to your pediatrician about it. And also with these latest recommendations, they don't recommend repairing lip ties or cheek ties. So those are a little controversial right now, but yeah, those are not currently recommended to repair. Keep in mind if your baby does get a tongue tie repair, that they're going to need to relearn how to eat because now their tongue is moving differently. So sometimes that can reset that 2-week clock. So if you are going to get it done, I'd say get it done sooner than later, just so that they're not having to learn twice how to eat. If you're going to be pumping, you can start as soon as your baby's born. And if you check with your OB, you might even be able to start before your baby is born. But keep in mind that pumping can induce labor and contractions. So just make sure that it's safe with your OB to do that. When you're choosing a pump, you can choose a manual or an electric pump. You can do one-sided or two-sided. There are some that have adjustable suction and some that don't. And there are some that are portable and some that need to be plugged into a wall. So take all of that into consideration when choosing a pump. A lot of insurance companies in the US will actually pay for a breast pump too. So check with your insurance about that. To get the best return while you're pumping, first and foremost, stay hydrated. Stay very hydrated because being dehydrated is the one thing that will consistently decrease your milk supply. So drinking lots and lots of water. Also, if you pump in the early morning, you can take advantage of that prolactin peak. So if you start pumping somewhere around 6 or 7 a.m., that will probably get you the best return. Also, you can pump while baby's latched on one side and pump the other side, or you can pump within 15 minutes of baby finishing eating. If you're at work and you're not able to be with your baby while you're pumping, it can help to look at pictures or photos, videos of your baby and kind of imagine that your baby is there breastfeeding because babies will actually move more milk than a pump can. And so just imagining that, visualizing that can actually help you get a little better return. There's a lot of herbal teas out there, lactation cookies, dietary supplements. If any one of them worked, honestly, it would be a prescription medication. So none of them are guaranteed to work in everybody, but they are generally considered safe and okay to try. So it is okay to go through those things. Just make sure you're not doing anything harmful. And outside the US, there are medicines that we can prescribe. There's one called domperidone that is often prescribed outside the US, but we don't have that available in the US. So really, here in the US, we just tell you, to maximize your pumping, to pump often, to stay hydrated, and to do it right after baby eats and or while looking at or holding baby can help. Your pumped milk will last up to 6 months in a freezer and can last even longer in a deep freezer. 6 days in the fridge and 6 hours at room temperature. So that's the rule of sixes. 6 months in the freezer, 6 days in the fridge, and 6 hours at room temperature. And the exception to this is that if you have frozen milk that's been defrosted, it only lasts for 24 hours. To give bottles to a breastfed baby and help them also continue breastfeeding, I have a couple of tips for you. And one great benefit about giving bottles to babies who are breastfed is that it allows your partner and other family members to bond with the baby and to give them a chance to really take care of baby and have that time. Also, it can allow mom to get a little bit of sleep at night. I always recommend pumping while your baby is taking a bottle so that your supply stays up because you're placing that order for them for their next feed. But sometimes it's easier just to breastfeed at night, but sometimes it can be easier to pump while your partner gives a bottle, and then they can help you, put away the milk and the pump pieces so you can get a little bit of extra rest. When you're giving bottles to a breastfed baby, you want to, and actually for any baby, you should brush their cheek with the nipple and then let them turn their head and latch on. Don't put the nipple into baby's mouth. You can actually hurt them by doing that. You can cause significant trauma by doing that. So let them latch onto it. They have that instinct and that reflex anyway to latch. So take advantage of that. You can start with the bottle horizontal and then angle it up after 1 or 2 seconds, and that will most closely mimic what it's like for them to latch onto the breast. So it takes a second or two for your milk to come down when they're first latching on. So I mentioned I don't believe in nipple confusion because babies, they can tell whether or not something's coming out of a nipple. But what does happen is they get flow preference. So if you have low flow or a regular flow, standard flow nipple, those are sometimes faster than the breast. And sometimes babies will get lazy and they love that, it just comes into their mouth super easily. And they don't have to work as hard for it. So if you use a preemie flow nipple, those are the slowest flow ones that we have in the US, the preemie flow, that will most closely mimic a breast and will make them have to actually work for it. And so that can help to keep breastfeeding established. Now for formula feeding, in the US, to choose a formula, we have a whole bunch of different types. So I recommend turning over the box and looking at the ingredients. The regular cow's milk-based formulas are the ones that we have commercially available that are most closely related to human milk. So I do recommend those ones. It is okay to do a goat milk formula, but regular goat milk is not okay. Regular cow's milk is not okay. No kind of animal milk is okay other than human milk. but goat milk formula is okay. So just double check that it has all of the vitamins and minerals added into it. Preemie formula is one that has extra iron, calcium, and calories, and that's because those things are laid down in the last month of intrauterine life. So just before your baby's born, that last month of pregnancy, babies are storing their iron, calcium, and fat. And so the preemie formula will have extras of those to compensate for that. Soy-based formulas are great if your family is vegan or if your baby has a medical condition called galactosemia. But outside of that, we don't typically recommend soy-based formulas. Definitely not for milk protein allergies because they do tend to cross-react with soy. So when a baby has a milk protein allergy, we have to go all the way to a hydrolyzed formula. Now, hydrolyzed formulas are partially digested amino acid-based formulas. They have the protein, fat, and or carbohydrates that have been broken down already, and they're a little easier for your baby to digest. And those are for babies with true allergies, so that can really help and make a big difference. The sensitive tummy formulas, I'm generally not a fan of. And that's just because they tend to have more simple sugars, and a lot of them are corn syrup-based. So just look at those ingredients on there. But if the first ingredient is corn syrup, not a huge fan. I will give you guys more info about this in the next episode on gas, reflux, colic, and spit ups. But a lot of people will switch to these formulas around a month of age. And I typically don't recommend that because they're going through their normal discoordinate stooling phase. And so we'll talk about that in another one, or you can go back to the 1 month episode and listen to that bit. Now, anti-reflux formula is a special type that has added rice starch in it. And rice starch, when it mixes with stomach acid, it thickens. And so it turns the milk into sort of like a cottage cheese consistency in their stomach so that it can just stay down a little easier and is not going to slosh around as much. So I do like those anti-reflux formulas if needed. When you're preparing formula, it's okay to mix up to a day's worth at a time, which is 24 to 30 ounces. And babies will typically eat 24 to 30 ounces for their whole first year of life. Once they get up to that level around a month of age, they stay there. It's just starting at 4 to 6 months, you're adding in extra food on top of it. So 24 to 30 ounces should last about a day. It's okay to mix it and keep it in the fridge. But once you've put it into a bottle and baby's had some of it, then you need to throw away any extra that's left over. It is possible to get ready to feed formula or liquid formula, and that should not be watered down. Just look at the package really closely because if formula is too watered down, it can actually be very dangerous for your baby and it could kill them. So just follow those instructions really closely. With the powdered formula, you want to follow exactly what it says on the can. Don't make it any more watery and don't make it any thicker unless your doctor has told you to, because those can cause serious problems with salt imbalances. The temperature should be lukewarm or room temperature. It doesn't have to be hot and it doesn't have to be body temperature like we used to recommend. So as long as it's just warm, that should be fine. And if you have clean drinking water from the tap, it's totally fine to use tap water. You don't have to use bottled water for it, unless your tap water is not safe for drinking. You should remember to burp your baby halfway through their feed, so about halfway through the bottle and then at the end again. And that will help to decrease gas and reflux and spit ups. And then anything left over in the bottle, throw it out at the end. So starting solid foods. The official recommendation is to start adding in foods at 6 months of age. So babies should have only breast milk or formula for the first 6 months of life. And then at 6 months, they will continue with breast milk or formula until a year, but you'll start adding in other foods. Now, here in the US, we sometimes recommend starting as early as 4 months, because earlier introduction of foods has been shown to slightly decrease your baby's risk of developing allergies later in life to that food. So you just have to know that they are ready to eat. And as pediatricians, we are screened to look for signs of readiness, but I can tell you those now. Signs of readiness are that your baby can sit with support, meaning that when you hold them sitting upright, their head stays upright. It doesn't tilt to the side. They'll start to watch you eat, which is just so cute. They'll start reaching and panting and showing interest in food. They'll start bringing objects and hands into their mouth and, chewing on their hands or sucking on things. And then they have to lose the extrusion reflex. And that's when you put something in their mouth, they'll stick their tongue out to push it back out. So one way to test if they still have this reflex is you can give them a spoon, just an empty spoon, baby spoon, put it into their mouth. If they suck it in and suck on the spoon, they're ready to eat. If their tongue pushes it away, they're not ready yet. So you try again in a couple of days. We recommend one new food every 3 to 4 days, and that's to watch out for signs of allergy, which looks like either vomiting 2 or more times within 20 minutes of eating or a rash on their body. And it can take a couple of exposures to the same food for them to develop the signs of an allergy. So that's why we say one new food every 3 to 4 days. But the food order doesn't matter anymore. We used to have very strict ways of feeding babies, and now it's a lot more lax than it used to be. And the latest research shows that it doesn't matter what you feed babies in what order, they pretty much all will eat a wide variety of foods by the time they're 1 to 1.5 years old. And then they're all going to become picky eaters by the time they're 2 or 3. And then they'll go back to normal eating when they're 4 or 5. So, what they're eating now is not going to stick forever. There are 2 foods that they cannot have before a year of age. And that is, the first one is honey or anything that contains honey. And that's because honey can have a spore for botulism in it, and that spore doesn't get killed when you cook it. So even things like honey graham crackers, honey Cheerios, honey ham, those are not safe for babies. And then the other thing is animal milk. So straight cups of cow's milk or goat's milk are not okay until after a year of age. But outside of that, they can have anything and everything. I like to personally recommend starting with the greens just because I found that some babies do get a little bit picky. So if you start with the green vegetables, those are going to be the least sweet. And then the orange vegetables after that are a little tastier. So that's like carrots, pumpkin, sweet potatoes. They're a little bit sweeter than the greens. And then fruits at the very end, because fruits do have a lot of sugar in them. Now, if you started with fruits, that's okay. You didn't screw anything up. It's, just keep going, keep offering a variety of foods. But I found that if your babies are not wanting or not liking the taste of greens, you can sometimes mix them with fruits, and that can make them a little bit more appealing. The traditional puree method of feeding is what we still recommend in the US, but baby-led weaning is starting to get more of a hold. So with purees, we used to start with rice cereal, and now they say rice cereal or oat cereal. It's not necessary. It's just empty calories and it's not very healthy. So you can skip it entirely and just start with baby food. The one advantage that rice cereal and oat cereal have is that they don't have a lot of flavor. So if you find that your baby is spitting out most of their food, you can try the rice cereal and oat cereal. You mix it with breast milk or formula and feed it to them. And if they still spit it out, then it's more of a coordination and oral motor skill thing than a texture thing than a flavor thing. If they do well with the rice cereal, then you can just move on immediately to the fruits and veggies, and you don't have to do anything else. And it's okay to give them meats and eggs and dairy products like cheese and yogurt all before a year of age, and really in any order. It's okay to give those. If you're worried about food allergies, especially if your baby's high risk, like if they have severe eczema or someone in the family or many family members have allergies, eczema, and asthma, then you could consider introducing allergens earlier rather than later. So I had mentioned earlier, when you're eating foods and breastfeeding a baby, they do get those food proteins. And so they get that passive exposure. But for formula-fed babies, you want to start introducing peanut proteins as early as 4 months of age. And the way to do that is either to get the powdered peanut protein and mix just a tiny bit of that, like 1/4 teaspoon in with their formula, or you can dip your finger in peanut butter and let them suck it off. And those are ways to expose them to peanuts to determine whether or not they're going to be allergic. If your baby does show signs of a food allergy, you need to stop that food and avoid exposure until after a year of age, and talk to your pediatrician before restarting it or re-challenging it, because it can get more serious the more times they're exposed to it. With baby-led weaning, you're giving babies mashed up foods that they can swallow, or you're giving them pieces that are too big to fit in their mouth that they just would suck on and they can't get pieces off of. So I recommend universally all parents, but especially those doing baby-led weaning, should take an infant CPR class so you can recognize the signs of choking if it does happen and know what to do about it. Now, when you start solids, you should also start water. And I typically recommend 1 ounce of water for each 1 to 2 ounces of food that you offer. They might not drink that much, but you should offer that much. And that's just because when you start the foods, they tend to get a little bit constipated because they just don't have as much water as their previously liquid diet. So a little bit of water. Also double check with your pediatrician. If your baby's 4 to 6 months old, just double check that you're not giving too much water, because around 6 months is when they can start to pee out that extra water if they don't have enough salt in their body. Yeah, before 6 months of age, their kidneys are not fully developed, and so they can get overloaded with water. The top 8 food allergies in kids are peanuts, tree nuts, fish, shellfish, dairy, wheat, egg, and soy. Now, the first four, peanuts, tree nuts, fish, and shellfish, they tend to not outgrow. These tend to be lifelong allergies and tend to be pretty severe. Whereas the other ones, dairy, wheat, egg, and soy, they are likely to outgrow, typically before age 5 and sometimes as early as a year of age. Of course, babies can be allergic to any type of food, any type of fruit or vegetable or animal protein. So just check with your doctor if they do have an allergy about how and when to safely reintroduce that food. All right, so for teething, the average age of teething is 6 months of age, but can happen anytime in the first year. And in fact, 1 in 2,000 babies are either born with a tooth or get one within the first month of life. Isn't that cool? So it can happen at any time, even and as late as 18 months of age, and still be considered normal. The typical order is that their bottom central incisors will come in first, and then the top central incisors, and then the top incisors next to those two teeth, and then the bottom ones next to those two front teeth. Then they get their molars, their four molars in the back, and then the middle teeth will fill in later. So for those of you who are planning for tooth fairy purposes, there are going to be 20 baby teeth total that are going to fall out in their life. An adult has 28 teeth. So yeah, we do have extra teeth that show up in teenage years, which is kind of cool. Signs of teething in babies, they'll be fussy, drooling. They may have a low-grade fever. Some of them will get some pink cheeks, like a little rash on their cheeks, and some will get a drool rash under their neck just because they're drooling so much. You'll see them chewing on their hands or on toys. Some babies will get diarrhea, and especially toddlers who are teething are more likely to get diarrhea. And that's because, like with those back molars and those back teeth, they tend to just swallow that extra saliva, and it just turns into slime in their intestines. So if you have a fussy toddler with just like a little bit of weird seeming diarrhea, it's just like a little smushy, that could be teething. And you might see tooth buds in there. With the bottom teeth, those tooth buds are going to be just on the inside of the gum line. And with the top teeth, they tend to be on the front of the gum line. So you might see a little bit of swelling in there before those teeth erupt. And you can see that even for a couple of months before the teeth come out sometimes. So if your baby's showing signs of teething, you can help them in a couple of ways. I recommend starting with teething toys, silicone toys that are, or any sort of safe baby teething toys should be fine. You can even give them a baby toothbrush to chew on. A frozen washcloth is great. So just like a clean washcloth with water, you freeze it, you let them suck that water out, and they love that. Or frozen fruit in a mesh bag, like a cheesecloth bag, or they make these things that look sort of like pacifiers with mesh on them or with like silicone pouches on them, and you can put frozen fruit in there and they can chew on it, but then they can't get chunks of the fruit out so they don't choke on it. So those are kind of nice. You can also do breast milk popsicles or put breast milk ice cubes or formula ice cubes in those teething bag things. And then if those are all not enough, then we can start with some medicines. So topical medications typically are local anesthetic agents. They have one of the canes in it, like lidocaine, benzocaine, prilocaine. You'll see like something that ends in cane at the end. And those last for about an hour or two. So if your baby's not wanting to eat because of the pain of teething, then I would suggest doing that before they eat. But it's not going to last super long. It's definitely not going to help them sleep at night to put that stuff on. So for the longer term stuff, you can use Tylenol or ibuprofen. Now, ibuprofen is only safe after 6 months of age. So babies who are 6 months and over, ibuprofen is going to be probably a better option because it's also anti-inflammatory and can help, but might delay the tooth coming out because they need that little bit of inflammation to get the tooth out. Tylenol is strictly for pain, is not anti-inflammatory, so you can give that at any age, and that is safe to do. Tylenol lasts about 4 hours. And that's called paracetamol in other countries, or acetaminophen is the generic of that. Those are all the same thing. And then after 6 months of age, yeah, you can do that ibuprofen if you wanted to. For oral hygiene, as soon as the teeth erupt, you want to start brushing them twice a day with plain water or with a fluoride-free toothpaste. Before they have teeth, you don't necessarily have to clean their mouth or do anything special. But if you find that your baby's prone to thrush, you can clean their tongue off with a washcloth after they eat to get that milk off of there. Sometimes that can help to prevent it. Then at 6 months of age, you can start with a fluoride supplement if it's not in your drinking water, or you can start doing fluoride toothpaste, but you only want to do the size of a grain of rice. So just a tiny, tiny bit of toothpaste at 6 months of age. And that tiny grain of rice size is safe for them to swallow once or twice a day. And then you should start seeing a dentist at 1 year of age, whether or not they have teeth. And that's mostly to get them used to going to the dentist. And sometimes they call it a happy visit where they just go in and they sit in the chair and they get to see, meet the dentist and the hygienist and then leave again. Sometimes they'll do a cleaning. Sometimes they'll put on some fluoride varnish. So I do recommend going to a dentist at 1 year of age, even if your baby doesn't have teeth, just to get them used to that experience. We found that we used to wait until 3 years of age. And the two big takeaways we had from that was that kids do have cavities before 3 years of age. Like, it happens, and that could be prevented if they're seen sooner. And they're terrified when they've not been to a dentist before, and their first experiences as a toddler, they're really scared to go in there. So we start at 1 year of age now. Now with thrush, if your baby has thrush, it's going to look like a white, thick coating on their tongue, and it won't wipe off easily with a washcloth like breast milk or formula would. So if they just have milk on their tongue, you can typically wipe it off, but if it stays there and it's thick, you should talk to your doctor about thrush. Sometimes women who are breastfeeding can get the thrush on their breast as well. It can spread there, and it feels like you've got glass inside your nipples when baby is latching on. It's super painful, and a lot of women will stop breastfeeding when that happens because they don't know what's causing it. They just know it hurts to breastfeed all of a sudden. If you do have thrush in your breasts, also talk to your doctor about that and see if you can get a prescription. We do oral pills for moms who are breastfeeding and a topical medication called nystatin for babies. And nystatin is just an antifungal medication that you just paint onto their tongue or squirt a little bit into their mouth a couple of times a day, and that can get rid of it. Thrush happens in babies because they're immune compromised. It's an opportunistic infection. And so that means it's something that's like always around, but typically our normal oral flora, like our good bacteria that live in our mouths, will fight it off. But since babies' immune systems are not fully developed, they don't fight it off. And so they are prone to getting it, and it can come back often. And so don't feel like you did anything wrong. It doesn't mean that the medicine didn't work, and it doesn't mean that they're not going to get resistant to it. You can keep using that medicine if it comes back. Just, double check with your doctor each time it happens to make sure you are treating it all the way. But yeah, it can come back often. All right, so that is everything having to do with feeding, teething, and oral hygiene. And next episode, we're going to talk about gas, colic, spit ups, and reflux, which is going to be a big one. So stay tuned, subscribe if you haven't already. And if you liked all this content and would like to see it all written out somewhere, well, you can pick up a copy of my book, The Baby Manual. It's all in there, just like this. It's a nice, quick, easy reference guide for new parents. So I hope this helps. Thanks. Thank you for listening to the Baby Manual podcast. Please hit that subscribe button below so you don't miss the new episodes when they come out. I would also love it if you could leave me a review. If you'd like to buy a copy of the Baby Manual, it's on Amazon and Kindle. I'm the author, Dr. Carole Keim, and that's spelled Keim. You can also follow me on YouTube, TikTok, Instagram, or Facebook to get some quick baby tips that will make you feel like an expert. Thanks for listening.